If you're joining a practice or working for a hospital or large health network, your options for malpractice insurance will be limited. You'll just get the same coverage as everyone else in the group. But if you're practicing on your own, you get to call your own shots. This can be both empowering and a little intimidating. What kind of policies should you get? How do you make sure you pick the right coverage that will keep you protected while also keeping your budget in mind? In today's episode, we'll give you some thoughts on the best type of malpractice policy for self-employed doctors. And the answers might surprise you. Stay tuned. Welcome to Malpractice Insights, the show dedicated to helping healthcare professionals understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. My name is Jennifer Wiggins, CEO of Aegis Malpractice Solutions, and I'm so glad you've joined us today. All right, let's jump in. There are two types of malpractice insurance in the market: claims made and occurrence. The easiest way for you to remember the difference between these two policy types is that the name describes how the coverage is triggered. If you have an occurrence policy, your malpractice coverage is triggered based on when the incident actually occurred. If you have a claims made policy, your malpractice coverage is triggered based on when a claim is made against you. So let's unpack this a little, starting with the occurrence policy. If you have an occurrence policy, the coverage triggers based on the date when the incident actually happened, regardless of when the claim is filed against the provider. So if a doctor treats a patient on January 1st, 2022, but the claim isn't filed for 3 years, the triggering date is the date that the incident actually occurred, which in this example would be January 1st, 2022. And as long as the doctor had insurance in place at the time of the incident, then he has coverage. So here's how that works. A doctor will buy an occurrence policy on day one, and then renew that coverage every single year until the time comes when he needs to cancel. After he cancels the insurance, then he can actually just walk away. There's nothing else required at the end of an occurrence policy, meaning no tail insurance. He simply moves on. Those occurrence policies will stay active and in force with the insurance carrier that he bought them from. So if a claim is ever made against him for a patient that he treated during the years when he was insured on an occurrence policy, then those policies will be available for him to access for coverage. Now let's take a look at the other type of insurance, which is claims made coverage. Claims made coverage triggers based upon when the claim is made against the provider. As long as the incident occurred during the coverage period and an active policy is still in place, the doctor will be covered for the incident. So here's what that would look like. A doctor will buy a claims made policy on day one and renew the coverage every single year until the time comes when he needs to cancel. But this time, when he cancels the insurance, he's not done. A claims-made policy is really two policies in one. You have to carry the insurance while you're actively practicing, and then after you cancel it, you have to get a second policy. And this is called tail insurance. Your tail starts at your cancellation date, and then it extends your coverage into the future for any claims that may be made against you after you've already walked away from that policy. Why does a doctor need tail insurance? Because he must have an active insurance policy in place in order to be covered for a claim made against him, even if it's years down the road. So when a doctor buys tail, he has to have an active policy that will cover him into the future for any claims that may still be made against him for services that he rendered in the past. It can take a minute to really let this information sink in and get a good handle on these two policy options. So I'd encourage you to check out a few of our other episodes after this one to learn more. We'll link some of our most helpful ones for you here on the screen, and we'll also put those in the show notes for you. Okay, so now that we have some foundational information on the two different types of malpractice insurance, How do you know which kind is best, especially if you're a self-employed provider? Well, the good news is that as a solo provider, you get to call the shots. You're not dealing with an employment contract that could restrict you with tail insurance or handcuff you into paying your way out in case you ever want to leave the practice. As a solo provider, you get to pick the policy that you want, and you are in the driver's seat. So, should you pick occurrence or claims made? Well, here are some reasons why you might want to pick an occurrence policy. First, you might want to pick an occurrence policy if you've been burned by tail insurance before and you never want to mess with it again. Since occurrence policies stand on their own, they don't need tail insurance. So this type of policy is best for you. Second, you might want to pick an occurrence policy if you would rather pay a consistent rate year over year instead of experiencing that steady uptick of rate that comes with the claims made policy increases, especially in those first 5 years. Many doctors find it easier to budget for their practice with an occurrence policy because the rates are more stable, although they're a little higher. Third, you might want to pick an occurrence policy if you want to maximize the value for your premium dollar. Because occurrence limits are retained year over year, the accumulated amount of coverage over the long haul is significantly higher than the coverage that you would have with a claims-made policy. Okay, so now let's switch to the claims-made policy. Here are some reasons why you might want to pick a claims-made policy if you are a self-employed provider. First, you might want to pick a claims-made policy if you need the most affordable coverage option as soon as you start your practice. Many self-employed providers are looking for a lower initial premium since they have so many other expenses as they get their practice up and running for the first time. Claims Made offers a lower initial price, which is very appealing to startups. Second, you might want to pick a claims made policy if you're forced to, meaning you either can't find an occurrence policy or you're coming from a previous claims made policy and need to carry your prior acts forward from another job. Claims made coverage is portable, meaning you can continue it from one carrier to the next in the event that you either switch jobs or want to pick a new insurance carrier. If you're already on a claims-made policy and you need to continue coverage in your new self-employed role, then you'll want to stay on claims-made to avoid having to buy tail insurance right away. Third, you might want to pick a claims-made policy if this is your forever job. For many self-employed providers, starting your own practice is a lifelong dream and is something that they plan on doing for their entire career. And although no one can predict the future, if you see yourself doing this job until retirement, then a claims-made policy may be the right fit for you because nearly all the malpractice insurance carriers will give doctors a free tail when they reach retirement. So not only can you save some money with a lower initial investment on your premium, but you can also skirt the issue of having to buy tail by keeping the coverage active until you officially retire from the practice of medicine. So, what do we see most often when we're working with self-employed providers? The numbers might surprise you. I'd guess that about 90% of self-employed providers that we work with select claims made as their coverage, and only about 10% choose occurrence. Why is that? The main reason why self-employed providers would pick a claims-made policy is because they need a lower initial cost to get their malpractice coverage started. And maybe more importantly, they get to call their own shots. They don't have the fear of leaving a practice or getting fired from a group and then having to pay a huge tail premium. Since most self-employed doctors see themselves working independently for the long haul, they look forward to that free tail at retirement, and they simply let the coverage continue each year that they practice. But at the end of the day, the choice is yours, and we're happy to help you compare your options and find the policy that's the perfect fit for you. If you have any questions on this topic or you want to make sure that you're covered appropriately, click the link in the description box below where you can connect with us via phone, email, or chat today. And if you're listening, please visit us online at aegismalpractice.com. That's AEGIS malpractice.com. And of course, if you haven't done so already, please don't forget to give us a like and a follow. And I'd really appreciate it if you could leave us a review. Your support really does help us to reach more people, and we're so grateful for your clicks and your kind words. This is Jennifer Wiggins. Thanks for joining us.